T, Technologic, brought to you by Top Tech.
3% of all people can be expected to develop epilepsy at some time in their lives. With the help of modern-day medication, most epileptics can live a normal life, but in cases where it cannot be controlled by drugs, epilepsy has become a life sentence. Nicola Davis was born with a lesion on her temporal lobe and has been suffering from epilepsy for most of her life. Because her prescribed medication had little effect on her condition, Nicola faced a life of dependency. Never would she be able to drive a car, keep down a stressful job, or live by herself.
The problem with epilepsy is that the seizures that affect you the most are the ones that are unnoticeable to everybody else, because those are ones that you have daily. And it's a spell that makes you very nervous and very panicky, and it feels bad, it feels awful. And it makes your environment seem very strange, and everyone just thinks you're really weird, basically, and you also think you're pretty weird.
Well, the standard treatment through much of the century has been medication. We have a number of medications, something like 10 medications now at our disposal to treat this condition. The efficacy varies, and some people are very easily controlled by medications, and a minority of patients, something like 20 or 30% of patients, continue having seizures despite being on these medications.
Unlike Nicola, Bruce Elliott responded much better to medication. Not only were the anticonvulsants costing him a small fortune every month, it also became incredibly difficult to do high-risk outdoor activities, such as mountaineering.
If I was overstressed or tired or missed a grade of pills, then I'd have it straight away.
In 1998, both Nicola and Bruce underwent an operation that changed their lives forever. Known as a temporal lobectomy, the procedure involves removing a small part of the brain in which the seizures take place.
In very simple terms, the operation is done when we know where the epilepsy is originating, and if the epilepsy is originating from one small region of the brain, which it doesn't do in all cases. And then the final caveat is that the procedure can be done safely. So where epileptic seizures originate in regions of the brain that are critically important for normal function, such as language or controlling the other side of the body, one has to be extremely cautious about doing the operation.
So the first step in this procedure is to identify the part of the brain from which the epilepsy originates. This is done through a series of investigations, the most important of which remains the EEG. EEG measures the brain's electrical activity, and brain waveforms can be compared. Abnormal waveforms in some instances are highly specific and are strongly associated with epilepsy. They can also tell where in the brain the epilepsy originates.
Typically what we would do is bring someone into hospital, reduce their medication if necessary. That's not necessary in all instances because sometimes patients are having daily seizures. So where necessary, we would reduce medication to induce these epileptic seizures and then record these. And typically we would record a number of seizures to ensure consistency, i.e. that the seizures originate from the same place in the brain.
I was eventually booked into Tygerberg for a week, and had all the tests done, laid on it on EEG for 7 days, and I was completely off my tablets then, and I actually had a couple of fits while on the EEG, and they saw exactly where it was coming from, where the focus point was.
It might come as a surprise that a sophisticated operation such as the temporal lobectomy was already pioneered in the 1930s and 40s. Technology, however, has refined the procedure and reduced the risks.
What has stayed the same over the years, since epilepsy started in the earlier part of the century, has been the clinical information and to a large degree EEG. There have been some improvements in EEG. What has improved dramatically is our ability to take pictures of the brain, in other words doing brain scans. And these images that I have here behind me are MRI scans, magnetic resonance imaging scans of the brain. And the ability to discern tiny abnormalities within the brain is what has improved dramatically in the last decade.
So when we went back to him, eventually he said, look, let's do these MRIs, and you know what? You're the perfect candidate for this operation. And I said, yes, I'm doing it.
The operation is 9 hours long. Typically, a patient will sleep right through the operation. But in some cases, where the surgeon is operating near the language areas, the patient will be woken up to perform a procedure known as speech mapping.
A small amount of electrical current, direct current, is passed through a probe into the surface of the brain, and speech would be monitored. And where speech arrest occurs, in other words, the patient stops speaking, the surgeon would know that we're in the region of language, and he would then not operate in that area.
What is that?
Wait, what is it?
Bell.
Okay, Joe. No.
This is a cup. This is a watermelon.
It was not easy at all. It was a bit scary, especially when you think that you might not remember who your family is and that sort of thing. But other than that, it was just one big fat risk that either I could take or carry on as normal.
I personally think that anyone who's had epilepsy for a substantial period of time, you won't even need to convince them. They'll be begging to have this operation because they'll know that that risk is worth it, whatever little risk it is.
The risks of the procedure are low overall, in fact very low. And I always use the analogy of getting in your car and going to work in the morning. The risks of having an accident while driving to work are small. They're not zero, and we implicitly take those risks every day. We ask patients when they consider this operation to weigh carefully the potential benefits of the operation against the small risks that there are.
Nicola and Bruce were prepared to take that risk, and it changed their lives forever. 10 of the 14 patients doctors treated last year are totally seizure-free, and the others have remarkably fewer seizures.
And I'm living in my own flat here now, and I'm independent. I'm driving. I'm working where I want to work. Before, I mean, my whole future was going to be with my mother. She was going to look after me for the rest of my life. And now I make my own choices.
TopTech's document management, workflow, ERP and CRM solutions enable you to manage your most important asset, your client. Today, your success depends on IT. Technologic, brought to you by TopTech.